Hi everybody, my name is Dr. Samina Mitha and I'm a naturopathic doctor, and today I really want to talk about food sensitivity testing that I do in the office quite often. And so about a year and a half ago I did my food sensitivity test, and it was a big eye-opening experience for me, and so I want to share my results. And then I just did the test 2 weeks ago, so I want to show you an updated results on how I was able to heal my gut, or I'm in the process of healing my gut. So today I'm going to talk about what is a food allergy or what is a food sensitivity, why you should get the test, and then we're going to look over my results. So basically a food allergy is something that you commonly see if someone has like a nut allergy. This is an IgE reaction, and so what happens is the body makes a response right away. So you'll see hives, you'll see shortness of breath, maybe difficulty swallowing, basically an anaphylactic reaction where someone needs an EpiPen. And so what an IgG reaction is, a food sensitivity reaction where the body might take a few days to make a response, or it makes a response with simple digestive concerns like gas, bloating, things like that. But what can happen is the body is really good at taking out these complexes of antigens and antibodies that the body is making to these foods. But if these antigens or antibodies increase in the body often, then what can happen is it can actually bury into the cell wall of the blood vessels, causing inflammation, and this results in specific conditions later down the line, such as eczema, maybe joint pain, arthritis. I've seen it affect reproductive health and things like that. So it's really important to make sure that it might not be digestive concerns that you're experiencing, but it could be related to another condition that you have, because at the end of the day, every single food particle that we're putting into our body is being used somehow in the body for energy or support. So we need to make sure that we can actually use it properly, and the body's not responding using an immune reaction. And so I'm going to go over my report with you. So this was a report that we did about in 2016 in April, okay? And so the report is really nice because it goes over different food categories. So anything in the red is elevated. I know this is backwards, but you can kind of get the idea. Anything in yellow is borderline, and anything in green is normal. So the green foods are free for all. So it goes over different sections like dairy, grains, etc. But then this is the nice part of the report because it kind of breaks it down. And these are all the elevated foods that came up for me. So as you can see, there's a lot of foods that came up in my report. And so it's really important now, like looking back, being like, okay, and even like healthy foods came up, grapefruit, avocado, cucumber, coconut. So these are ones that, I have in my diet, maybe not all the time, but like often enough for me to say that it's a problem that my body is making an antigen or antibodies to it. So basically, and these were the borderline foods over here, and then these were all the normal foods that I could eat. So this, when a lot of foods come up like this, because this never really comes up in my office, so when a lot of foods come up like this, it's a signal that it could be something called leaky gut. And so leaky gut is when the cells in the small intestine, they should be sitting very close together like this. But what happens is if the body gets leaky, and the cells kind of start to come apart like this, now antigens can get through and then go into the bloodstream and create an immune reaction. So, and gluten actually can, if you're sensitive to gluten, which I am, it can actually cause this opening of these cells in the small intestine. So it's actually really important to realize that this could be leaky gut, and making sure we try to heal the gut back, so put these cells back together and make sure that we're not creating a response. So did a lot of gut healing in the last year and a half, so with glutamine and bone broth, fasting, and even zinc carnosine, and just making sure that I wasn't kind of reacting, taking out the high foods. So the highest foods were things like egg, rice, almond, oranges, milk, were like the really big ones for me, corn, and beans. And so I removed all those foods, started healing the gut properly, lots of probiotics and omegas and things like that. And looking at the report now, so this time the first time I did 120 foods. This was just a 120 food test. And then the second time I said, you know what, let me do the full 200 food test, because at the end of the day there could be other foods that I just wasn't aware of. And also it's nice because it gives you chickpeas, which I eat hummus quite a bit, and so I wanted to know for sure if chickpeas was a thing, and I'm pretty sure it wasn't. Yeah, so actually chickpeas were in the normal. So I'm really excited about that, because sometimes I do feel like hummus can irritate or cause bloating. So anyway, so this is my new report, and so as you can see, the number of red foods has gone down, and now I have some of the foods in the borderline, but all the like good foods like avocado, coconut, all the fruits and vegetables are kind of removed from this report, which I'm really happy about. So it means that I did a pretty good job. Rice is still elevated, almond is still elevated, milk actually went down to borderline, but that's probably because I don't eat it as often. And so there's two things. People say like, oh, isn't it just the foods that you always eat that will come up elevated? But it's not necessarily the case, because there's foods that I eat all the time that aren't in this elevated section. Now the report will tell you sometimes foods that you eat often, but it also gives you an idea of what foods you are really reacting to and you shouldn't be consuming often. And then later on down the line you can start consuming it once in a while. Yeah, so it looks like I did a pretty good job. There are obviously a lot of foods still in this section, but that could also be because I did 200 foods this time. So there are things that are in the 200 section, but it's a really good indication that I'm on the right track. And I also the report is nice because it can give you an indication if you can add on a candida report. So I did candida and it came up positive, so that means my body is reacting, my immune system is reacting to the candida that is still there, and so that's yeast overgrowth. And that basically comes from, for myself, it has come from lots of antibiotic exposure as growing up. Antibiotics was used often in my case, and so now I have to go back, do a little bit more healing. Now I know where I need to start. I can start eating some of the foods, like rotating some of the foods in the borderline and then removing the foods again in the elevated. Now there's quite a bit, but I'm still going to do the top, the top ones, and then in borderline still rotate them out. So what you do is for about a month after you do the report, you're removing all the elevated foods in borderline, you're eating them every 4 to 5 days, and you're still healing the gut with things like, again, glutamine, maybe some liver support, some immune support, and things like that. So it's a great report to do. I recommend it to quite a few of my patients just so that they get an idea of what their system is reacting to. And sometimes they realize, oh yeah, like, bread actually irritates me and I need to get rid of it, or maybe it is almonds or cashews, whatever it is. So it's a great report, and it's also really great if a mother is breastfeeding and the child is having some issues with spit up and colic and things like that. So the mother might be passing on some of her immune system markers to the baby, so, and maybe even eczema for the baby. So doing the report for the mom is really great too in that case. So if you have any questions, please feel free to reach out and ask me about my food sensitivity report, or if you would like to do one. My email address is info@saminamitha.com, and I'm currently practicing in Kitchener and in Toronto, just north of Yonge and Eglinton. Take care, guys. Have a good day.